In this session, I'm going to tell you about your humidifier for the ResMed AirSense 10 or AirCurve 10. Humidification is very important to successfully getting used to PAP therapy. So it's important to learn how to use your humidifier. The humidifier should be used if you are having a dry nose or dry mouth, nose congestion or nose running, or sneezing. Also, consider increasing humidification if you're removing your mask during your sleep and not intending to, or if you think you are opening your mouth during sleep. Some clues to you opening your mouth and not realizing it could be seeing leak on your machine report. If you find that you're getting too much humidification, you may need to turn it down. This would be if it's feeling too moist or too hot. But remember that if you're getting condensation in the tube, the first step is actually to warm the tube before reducing the humidifier. To get to your humidifier, you will go to the home screen. You do that by pushing this button, and you'll see My Options and Sleep Report. We want to go into My Options to find the humidifier settings. You highlight it in blue, turning the knob to get it highlighted, and then push it to enter that screen, pushing the silver button. Then again, you're going to turn the button to scroll down to Climate Control. There are two options for climate control, the automatic setting or the manual setting. I recommend you change to the manual setting so you can make further adjustments to your humidifier. You do that by pushing the button to go in, turning the dial, and then push again to save your change to manual. Then you will go down to humidity level. Often the default is 4. I recommend going higher than that. A range to start at is 5 to 6, and if you need more moisture, then you can go up as high as 8. The tube temp is above. This is where you're controlling for condensation in the tube or in the mask. It defaults to 81 degrees Fahrenheit typically. You can keep that there. Although it says 81 degrees Fahrenheit, it will not feel that warm to you. This helps to keep your humidity level higher without causing the vapor to condense in the tube or the mask back to water. So here I have changed my humidity level to 5 by going in, turning the button, and then saving my setting by pushing the button again. And then I left tube temp at 81 if that default setting is what you see. If you're seeing a lower number, you will want to bring your tube temp up to at least 75 to 80 degrees Fahrenheit, and you may need it to be higher. If you would like to activate your humidifier while you're getting ready for bed, you can go to the Run Warm-Up screen, which is lower. You push again to say OK, and now it's going to start warming. You can tell this by the icon at the top right corner. And this is warming your water without actually turning on the blower of your machine. I'd like to tell you a little bit about the pieces to your humidification. First, you have the option for heated tubing. You'll know that you have heated tubing if your tube also has this little electrical port which runs the heater. If you don't have this, you can call your medical equipment company and ask them if you're eligible to get heated tubing. The heated tubing has a little port, a plug that you will insert the electric port into, and make sure that you get it into that slot and push it in until it clicks and is firmly in place. This also can move as needed to give you more flexibility in the bed. The humidifier chamber is what holds the water. And this is a plastic chamber that can be opened. What you want to do is you want to fill this with distilled water and up to the maximum fill line, and you only want to use distilled water. You would not use tap water or well water in this. And you want to dump your water every day after you've used your machine and leave it open like this to dry in between use. If you have a lot of water left, you may need to even dry it out a little bit with a towel so it can completely dry before you use it again. Once you put water in, you will close it and put it into the machine. The way this works is there's a metal plate on the bottom that sits against a metal plate in the machine. The metal plate is where your humidity level is determined. As you raise the humidity level number, it heats the plate more, heating the water more, allowing more moisture to come out of the chamber and into your tubing. As more moisture is coming out of the chamber, if this tube is not warm enough, then you will get condensation of the water in the tube or in the mask. So you want to make sure that you keep your tube warm enough so you don't get that condensation, and turn your humidity level high enough so you're getting enough moisture to be comfortable using your PAP machine. If you're still having trouble after adjusting your humidifier, then you should call your medical equipment company who provided you with the machine. Often there is a sticker on the machine that gives you their name and phone number, or call the doctor's office to ask for help from the provider who prescribed the machine for you.